This is the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. Brought to you by Keating Dental Lab, a full-service, award-winning dental lab that is here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.
Good afternoon and welcome back to the Dental Lab Podcast. I'm Bob Brandon, the General Manager here at Keating Dental Lab. Today we have a very exciting topic, something that I'm really getting interested into recently, and I have two fantastic guests for you. I have Bruce Barton and Kim Solomon. Bruce is in Oregon, Kim's down here in Southern California, both from a fascinating company that has extremely high quality products. We're proud, all of us here at Keating are proud to work with Panthera Dental. Gentlemen, good afternoon and welcome to the Dental Lab Podcast.
Good afternoon. Thank you, Bob.
Afternoon. Thank you, Bob. Good to be here.
Absolutely. Kim, it was great to connect with you again recently. I know you had a great run here and we had a lot of fun together working here, didn't we?
Yes, we did, Bob. I'm so thankful that I got to spend some time with Keating and explore all the great products and services that you offer into the dental market. And I feel that our topic today is a new evolving role, not only in dentistry, but also it moves over into the medical field as well. But just learning about it more every day, it's fascinating how much it really helps patients and dentists be able to treat something that's real and it's actually growing more relevant.
I couldn't agree more. And as we all age, we tend to snore a little bit more. Our airway gets a little bit more constricted. There were some of those nights when Morbrook was here and we were working through the nights on those cases. I would come in the next morning and I wasn't so refreshed. And now, again, being 5, 6 years older, I feel the same way some mornings. And I know it's because I didn't get a great night's sleep.
Absolutely. I hear it daily. And it has to do with aging, of course, but we all lead stressful lives. And unfortunately, we tend to lean on the caffeine approach in the morning to help bring us back
Yeah.
versus better resting at night. But no, I do think this is something that's prevalent and everyone can relate to exactly what you're feeling. And it may be something more than just not getting your 8 hours in too.
I'm lucky if I get 6 hours, sometimes 5.
Yeah, don't we all? And if we only get 5 or 6, it's got to be quality sleep.
Absolutely. Yeah. So let's get into it. And the listeners, if you guys haven't figured this out yet, Panthera Dental they have a phenomenal array of products, but some of my favorite are the anti-snoring products, the sleep apnea devices, and the orthotics, the night guards. Kim and Bruce, why don't you guys take it away? Why should a regular GP here get involved with sleep dentistry?
Go ahead, Bruce. I'll let you start.
I think sleep dentistry, to start off with, what we're talking about is oral sleep appliances. And since the dentist obviously is working in the oral cavity, they're there already. They can see signs, and it's a great place to start for diagnosing that for patients that have issues. Many patients, and we'll get to it, but like myself, I was diagnosed with mild sleep apnea, but I just did not want to wear a CPAP device. And many patients are like that, or they're not very compliant. But I think it's because it falls in the dental arena, already in the mouth, already seeing patients and treating patients. It's a natural progression in there why dentists should be involved. And Kim, you can pick it up from there.
No, thanks, Bruce. Absolutely. The ADA promotes active screening for oral cancer, and hopefully your dentist does that for you when you go to visit either once a year or every 6 months. And it's a simple screen, but what they're looking for are telltale signs that something may not be right. And from there, then they can recommend you to a specialist, of course, to take secondary precautionary measures if something should come up. At the same time, this is an excellent opportunity for the dentist just to do a quick screening to see if the patient is showing signs of having what we call sleep apnea stressors. And those can be from a number of things, from just tongue thrusting at night, trying to breathe, where the tongue actually will start taking on a scalloped approach like your teeth. I've asked many patients before in consultation, just stick your tongue out. And if you have this type of scalloped tongue, you're already showing signs of having stress, which leads to not being able to breathe at night. So again, I think it comes back to awareness and also at what participation level that the dentist may want to take up in his role. And that's the nice thing about this, that basically the dentist can be the front runner in finding and determining if the patient is possible a candidate to have other treatment options done with sleep apnea.
That's great. And Panthera Dental has a wide array of videos on the website that sort of walk a clinician through some of these diagnostic criteria that you just spoke of. What are some of the other tests, like a sleep study lab? What are some of the other ways that dentists can get involved in the sleep arena?
There's several entry roles that they can take. Again, I think that the dentist needs to decide, number one, what his role is going to be. If he wants to participate in actually diagnosing and treating sleep apnea, there's a pathway for that. If he wants to work as a referral to his physicians that are also treating patients with sleep apnea, there's a pathway to that. Or if he just wants to screen and then work as a referral and participating and heading off, where the patient's choices are and who he might see, I think there's a pathway that can be obtained. So all three of these basically start at the beginning. And that is, if a patient is showing signs of having sleep trauma while they sleep and or asking the dentist saying, I'm really not sleeping or I'm grinding my teeth, that can be a precursor to sleep apnea. Not necessarily so. Stress does incorporate us to grind our teeth at night, as well as light snoring, but those aren't really what they call gateways to sleep apnea. It's really understanding how it's developing within you and also what the signs are. And then some of the options you may have is there are now at-home sleep tests. So patients can actually take the test home, sleep with it a couple of nights. It's no more invasive like some of the earlier testing was with all the wires and gadgets that you're hooked up to. And they can get some results in which will give them what we call sleep apnea scoring, which allows the dentist to actually see by the test whether or not they're having sleep abnormalities at night. Again, several pathways. I think if a dentist is wanting to learn more about this, there's a lot of places that they can begin their investigation on it. The DSM, which is the Academy for Dental Sleep Medicine, is one of the first stops I would send them to because they have a number of articles that dentists can read as well as some of the others.
Those are all great points because somebody like me, I just keep waiting for Apple to come out with an add-on to the health app. Oh, you have sleep apnea. You stopped breathing for 30 seconds last night. Those are great points. And yeah, we here at Keating, we have a large number of customers that are just starting to dabble into the sleep dentistry realm. And I think that the dentist role, like you said, Kim, they need to take it in a stepwise progression, be comfortable with it. And then in terms of treatments, and you guys have some great devices. I'm a big fan of all of them, really. But why don't you walk us through what Panthera Dental offers in terms of your sleep apnea devices?
Sure, Bob. We have two devices. And if you're looking at sleep therapy devices, the main focus of the device is to move the mandible forward so that it physically opens the airway so you can sleep. So it's a physical application, and most of them refer to them as an orthotic, but it's really a device that manipulates the mandible. We call it a mandibular device as well. So we have two. We have one that's called the Classic, which is our premier flagship product. This is connecting by rods. The rods are what actually create the push motion for the mandible to go forward. And then we also have one called the X3, which is done with the dorsal fin. So it basically uses that fin as a slide motion to slide the mandible forward as you close the mouth, and it's not connected. So you have a little bit more freedom, but both of them can accomplish the same prescription setting that your dentist or medical doctor could apply for you to begin to get therapy for sleep. Interesting thing about once you're diagnosed with sleep apnea, it's one of those types of things that you're never going to get better from it. There's not a treatment. And in fact, it gets worse as you age. However, you can get treatment for it. There's not a cure. I'm sorry, I misspoke there. There is treatment. There's not a cure. And so this is another way for us to have products that can work for us in our daily lives that we can adapt to. Because the golden standard for really sleep apnea is the CPAP machine. And a lot of people can't tolerate that at night. They're claustrophobic. It wakes them up. And depending on where their sleep apnea score is, they may be a candidate for an appliance, which is a much more easier product for them to use and adjust to. Again, I'll come back to Bruce, who's joined us here, who just started therapy with his device as well.
Yeah, Bruce, why
Yeah.
don't you share with us your story on how you were diagnosed, what the level is, and how therapy is going for you?
Yeah, happy to. So I started out, as most people probably do, the prodding from their wife saying, I'm going to divorce you because you're snoring too much. I can't sleep and I can't stand that anymore.
It's 3 or 4
And
times a week for me.
yeah, exactly. There was motivation there to let's see if we can get some treatment for this problem or really see where it is. Because it wasn't as far as I knew, it wasn't keeping me awake at night. I slept fine as far as I was concerned. So I went and did a sleep study. And when I was hooked up to all the wires and things like that, and as Kim mentioned, there's other methods now, I think, but this was a while back. And so I was diagnosed with mild sleep apnea. And the choices were really mostly was talked about is using a CPAP. And I just did not want to wear that thing over my head all night. I didn't see how that was going to help me sleep better. I thought it would be worse. I've had friends and family that I would travel with, work, things like that, and they'd have an extra suitcase they'll have to travel with because of their apnea. And they look like the man from Mars when they're going to bed at night. I had initially looked and I knew being in dentistry, being in dental, I knew there were oral appliances. And so I started kind of looking into it. And it was really before I was with Panthera. And I had just bought online a simple sleep device. It might have been $100 or something like that. And so I wore that for a while, but it worked okay. I think it helped, but I still didn't like wearing it. And when I would travel, I would leave it at home. And because, okay, I'm by myself, I'm not going to keep myself awake. I wouldn't take it. And so I just leave that at home. And that was my break from wearing that. Then after joining Panthera and learning more about what the devices that we have to offer, I thought I should look into this better because it seems to have more efficacy on that and more science behind it. And so I actually wear the classic device with the rod, and it is very comfortable, I can say. It's much more comfortable than even the mouth guard type device that I was wearing before, so much so that I travel with it because I don't find it to be uncomfortable to wear. It's comfortable to wear. I know it's helping me get better sleep. I feel it. I will go. I don't have a problem going to sleep, but that I can do that fairly easily. And then I'll find myself just waking up feeling more refreshed and all I've been asleep and wasn't even aware of it. I can attest to that it works and it's very comfortable to wear. Not obtrusive, not bulky in my mouth.
Can you recall what type of records your dentist took for the fabrication of the device?
They started out, it's a good question because that is very important. And so the dentist does need to use a George gauge to measure the protrusion of the lower jaw. And so finding what the maximum protrusion is and identifying that with the George gauge, and then taking a bite registration in a protrusive position. And the key thing with that is that the way Panthera constructs a device, they're not constructing it with the rod in full protrusion. We're only creating it at a 60% of maximum protrusion. So there's room for movement in there. Did I get that right, Ken? Did I get the right correlation there?
Yes, you did, Bruce.
Yeah, that
It's
sounds right.
it's really a combination of understanding how far the patient could protrude out and then retrude back in and finding what we call that sweet entry spot to set them to begin therapy.
Yeah, because if you set the mandible at maximum protrusion and the device is constructed that way, it often winds up on the floor or in the bed somewhere.
Absolutely. The goal is not to put the patient in pain. It's to
Right.
start the therapy and then use the system. The classic comes with 16 different rods that your dentist can help you interchange. And by moving half a millimeter at a time, which isn't a lot, but it is a lot when you think about putting a little bit of stress on your jaw.
Now let's switch over to the X3 because this happens to be one of my favorite devices and a real crowd pleaser amongst our current customers. Talk about the development and the construction of the X3 and how it functions in a slightly different manner.
If you divide the sleep appliance industry up, basically have two camps. You have those that are asphyxiated with a rod, a strap, some even a strong rubber band. There's different names that they give them, but they are connected. It's usually connected somewhere on the molars and then somewhere by your bicuspid on your upper and lower. Well, the mandible maxilla basically is referred to in dentistry. So the difference shift in the X3 is that, first of all, they're not connected. And so you have a ramp that's built on the lower, the mandible, that's like a dorsal fin. And this dorsal fin has a slight degree taper to it. And there is basically a joining clip that slides into a holder that is actually going to give you the amount of protrusion that we're going to start with, as suggested in the prescription by the dentist, that allows you to then slide up and down that ramp as you open and close, therefore giving you the forward mandible movement, just like the classic does. So both of these work in the same type of sequence to get the mandible to move forward. They just have different ways of getting it there. The nice thing is they're both very slim. They're both light. The dorsal fin is one of the popular ones on the sleep market today. So patients do gravitate towards that. And that's one of the reasons why we began to design and manufacture. It's been on the market now for about 3 years, came out right before COVID. And our classic product has been available for about 12 years. There's a little bit of history in between the two and how the market shifted.
And both devices are made from a very unique material and constructed, fabricated by you guys in a unique way without, divulging too much, if you don't mind. Because I've been tremendously impressed with the strength and durability of both devices. Can you comment on how they're made and what they're made of? What separates you guys from everybody else?
Okay. They're 3D printed is the process how we manufacture them, and the material is a polyamide nylon 12. So it's very durable, very strong. You can actually, if this was on video, you could see, you could squeeze it in your hand. It doesn't break. It's not brittle. Not only is it strong, that allows to be able to manufacture it, as Keeman mentioned, very thin, lightweight. It's not bulky at all. So it's not really obtrusive in the mouth. And it also is a very smooth texture, almost slick. So I can even attest to when I'm wearing it at night, I have no problem, even once I put it in, to talk, to drink water, to do anything like that. And it glides and slides the opposing arches over the planes on it. So it's very durable, very strong. And it carries, because it's so strong and durable, it carries a 3-year warranty on the product as well.
Yeah, that's amazing. I compare your appliance to something like the tap, and just looking at it on the benchtop is like, I think I'd rather wear this one. Your guys' appliance is lightweight, very smooth, and extremely durable, very strong. Like you said, you can't really flex it at all in your hand. And the muscles of mastication can break almost anything. They can break crowns, that's for sure. But 3 years with this nylon material in the mouth, I still haven't seen one come back as broken.
That's good to hear, Bob. But we do also offer a 3-year warranty on the product. It's called our 360 warranty, no questions asked, which supports the doctor should something fail on it. We don't live in a perfect world. Things do happen. And we fully support that. The nice thing about ordering a Panthera, since it's fully digital, is we capture all of the prescriptions and all the devices we've made. We keep those in a cloud reference. So if we ever need to make another one for it, you can call us with the patient's product number and also their patient number, and we can find that and reprint them as well. So as long as they haven't had a lot of dentistry done in between the time they had it to where they are now, they usually work pretty well for us doing a reprint.
I love that fact. It's the same here when patient loses or has a digital denture that's destroyed. Okay, just patient name, shade. Let me look that up, and yeah, we'll print you another one.
Absolutely. There's really a great opportunity right now, Bob. I just got the announcement that Compendium, which is an Aegis Media product that just came out with a new June issue that actually has diagnosing and treating sleep disorders. And it's full of all types of case reports and clinical reviews by a number of the top clinicians in the market today, both from ortho, prosthodontic, oral surgery, ENT, medical doctor. I was blown away at the group that they brought together for this issue. So if you are a receiver of this distribution that goes out from Aegis, then please take a look at that. It's a great way to bring yourself up to speed on sleep, but also give you a little entryway into just how much it affects your patient and the service that you could be doing for the patient and helping get therapy. I refer to it as the why. Why do we do something? Why do we do the treatment options that we offer in our practice and putting ourselves to help patients daily with our services? And I think this is one that continues to give every day, just like great crowns, bridges, the products that the laboratories produce to help change patients' lives. And this is just another of those key products.
I agree with you. I think a lot of dentists get bogged down in procedures. Oh, I've got Mrs. Jones in my chair. She's got an MOD on tooth number 14. Okay, this is the procedure for that. Oftentimes, they forget that there's a human being connected to that tooth, and something as simple as asking a question, how are you sleeping? And some of the other diagnostic criteria that you had gone through earlier, and allowing Mrs. Jones to open up her airway, to sleep better, to breathe better, be more refreshed, get more oxygen to her brain and organs at night. That's, to me, it really should be a no-brainer. This is something that all dentists can do to help their patients live a healthier and better life.
Yeah. I think I'd like to ask Bruce this question. Now, Bruce, besides the snoring part that your significant other was referring to, when did you actually start feeling better after wearing the device for a period of time?
I'd say after wearing it for as little as a week to 10 days, I noticed it right away that I seemed to have deeper, more restful sleep and then would wake up. I pretty much now have stopped. I don't even use an alarm to get up in the morning. I wake up pretty regular at between 6:30. I get about 6 hours of sleep, maybe 7 hours a night, and I'm good all day. I've never been a napper, napping during the day, but prior to that, I'd feel sleepy, feel tired during the day, that kind of thing, but certainly not now.
Nice. Thank you for sharing.
Yeah.
I think you're going to motivate me to get one too, Bruce.
Yeah, I would highly encourage you, Bob. It's your turn now.
Have a
Wife will
part,
thank you and me.
yeah, we'll have a part two on this, and I'll be a new patient as well.
That'd be great. Love to make you an appliance, Bob.
Awesome. Guys, I really appreciate the partnership and the support as always. Keating Dental Lab's going to be running some specials here for our customers really soon. You guys have been gracious enough to provide literature, marking materials, some patient demo models, which I think are very important as well. We're going to kick this off here real soon. And again, I can't thank Kim and Bruce enough. The company's name is Panthera Dental. Great location. Yeah, why don't you guys share with us where the headquarters and where the device is made, just real quick?
Yes, everything's made up at our headquarters in Quebec City, Canada, and is sent to us overnight through FedEx to our customers, our laboratories, and our dental customers in the United States. Since we work on a digital workflow, it's pretty seamless. If you have an intraoral scanner, capturing the information we need and getting it over to Bob, it's getting it translated up to us is quite easy and efficient. But we also work with an analog delivery system as well. For those of you who are still taking impressions, we make sure we have open access for you to get the product in several different ways.
And about 80% of our cases are received from a digital scan, but we can work from conventional impressions and pour the models. And the bite registration, as Bruce was describing with the George gauge and maximum protrusion, is really important. Sometimes I get the bite registration on the cast and I was like, oh, wow, this patient really couldn't protrude very far. They're still in a class one occlusal relationship. So then that's a call back to the dentist and okay, is this a CO bite or is this a protrusive bite? And sometimes we have to repeat that step, but either way the dentist wants to work, we can accommodate that.
And
Awesome.
I would add to that, Bob, just to reference back what you said earlier in the podcast is your client can reference to you and get directed even to our website, the Panthera website. We've got videos, about using a George gauge and the proper way to take the bite and some of those small little technique things that we have those resources available.
That's great. I'm going to start recommending that. And definitely anybody listening, again, the website is Panthera Dental. And I think, is it on the references? Is it under references tab for the videos, Kim?
Yes, they basically are located. When you go to www.pantheradental.com, it'll open up, and we actually have 3 channels that we have products for, and it'll be under the sleep channel. When you open that up, should I say channel link? When you open that up, it will take you to you can scroll and see where the videos are. We have a number of technique videos on the products, on processing as well, and also on ordering. Try to go to A to Z on helping a doctor step through the process for this first time. As always, if there's questions, we're here to help as well.
Guys, thank you so much. I really appreciate it. I appreciate the time and your insight. And we'll follow up here real soon with another part where we can actually delve into a little bit more of the science of sleep dentistry and why it's so important.
Thank you, Bob. It's been
you,
great.
Bob.
Thanks for having us.
Okay,
Bob,
guys, have a great afternoon. Take care and thanks again.
Bye-bye.
okay. Thanks. Bye-bye.
Thank you for listening to the Dental Up Podcast, your daily source for insights from dentists and leaders in the industry. This episode is sponsored by Keating Dental Lab, here to add value to your dental practice. With high-quality restorations, friendly, reliable service, the best products, and prices, come experience the Keating difference. Visit KeatingDentalLab.com for details.